Hello, and welcome to the Happiness Project. Are you feeling extremely anxious and don't know how it will ever get better? Are you here to learn coping mechanisms or simply want awareness? Stay tuned because this video is for you. Anxiety is a natural part of life. Long amounts of anxiety, on the other hand, might be detrimental to a person's social, career, or personal life, and to cope, people may try a variety of strategies. About 40 million American adults have an anxiety disorder, according to the National Alliance on Mental Illness. This makes this disorder the most common mental illness in America today. In today's video, we want to guide you in recognizing early warning signs of having anxiety and knowing when to seek help. However, this video is only intended to serve as a reference and should not be taken as professional advice. People with anxiety disorders may have constant and uncontrollable fear that interferes with their lives, and it usually develops when constant disruptive feelings and concerns are thought of. Anxiety problems almost always necessitate medication. If you find this video helpful, make sure to subscribe to the channel and click that notification bell, like, share, and comment saying "I subscribed," and we'll make sure to reply to them personally. Now, let's start with symptoms of anxiety. These are the common signs: surprise, panic or worry, rapid heartbeat, chills, chronic sleepiness or weariness, frequent shortness of breath. Anxiety and fear can both be felt at the same time. These are several techniques for dealing with panic attacks, including focusing on a specific spot, repeating a word, and relaxing. Here are 3 stress-relieving methods to relieve tension that you can do. Number 1. Stretch it out. It will help your muscles, joints, and back. As an immediate physical antidote to this natural reaction, stand or sit with your feet apart and open your chest. This gives the body the impression of regaining control. Number 2. Relax. Taking a few deep breaths can help. Anxiety can be relieved in a variety of ways. Do you have stress in your heart? Maybe you just get jitters when you're confronted with a threat or in a high-pressure environment. It's an excessive stress response. Our body's natural response to stress is anxiety. Targeted therapeutic breathing in its proper form. Inhale for a count of 4, then exhale for a count of 5. Your heart rate will be more even as you breathe more slowly, causing you to relax. Number 3, examine and test your thoughts. Negative thoughts can quickly turn a terrible situation into a terrible mood. Perhaps the most effective technique to deal with a phobia is to face it head-on and discover where you can regain control. If you haven't yet recognized your triggers, be mindful of the following warning signs. Situations such as your first day on a job, getting to know your partner's family, or speaking in front of a large audience. Anxiety affects everyone in some ways or another, so you'll have to look into yourself to figure out what your triggers are. For the time being, attempt to alleviate your worry in any manner you can. Here are some suggestions to help you when your anxiety rises and interferes with your ability to concentrate or complete tasks. Essential oils. Use these aromatic oils such as lavender, chamomile, frankincense, and sandalwood, since they have a relaxing effect and can alleviate any bad feeling. Aromatherapy may help you relax by activating your olfactory receptors, according to some studies. Take a walk or practice yoga to de-stress. Disengaging from the environment is often the most effective way of suffocating worries. Leisurely exercise can help you relax and release your stress away. Put your thoughts on paper. It will have the opposite impact if you write down what is bothering you. These particular strategies are excellent for people who suffer from anxiety on a regular basis. They're quite beneficial to people who suffer from generalized anxiety disorder, GAD. If you're not sure where or how you can begin, speak with a mental health expert about your options. They can provide solutions that can help, or they might simply suggest something you hadn't thought of. Track down and identify your trigger spots. The easiest method to find a trigger is to look for one on your own or get advice from a therapist. If you find your trigger, try to keep your exposure to a minimum. Other strategies may be effective if you are unable to minimize them. A stressful job, a challenging setting, and being on the road are all triggers. You may be apprehensive as a result of your genetics. Some medication, treatment, such as claustrophobia, fear of confined spaces, And many chronic illnesses such as cardiovascular disease, diabetes, or an asthma attack may be reversible, but others are not. Long-term pain suffering from a major psychological condition such as depression is one of the side effects of some medication treatment. New thought and response patterns are incorporated into cognitive behavioral therapy, CBT. Before a negative pattern or behavior becomes out of hand, a therapist can help you develop new, more beneficial methods to deal with the situation. Try a yoga session if remaining in one spot and concentration is tough. It doesn't matter if you practice every day or perhaps once or twice a week. Even though it's challenging, with enough practice, your brain can learn to turn off worrying thoughts. Adding supplements or changing your diet may help you achieve your goals. According to a study, various vitamins or nutrients may help with anxiety reduction. It would most likely take 3 months for your body to fully absorb the nutrition from these herbs and meals. If you're taking any additional medications, please consult your doctor. Have a good mental and cardiovascular health. Staying in shape, eating nutritious meals, being connected to people who care about you, and getting enough sleep are all excellent methods to reduce stress. Tell your doctor about any prescription medications you're taking if you have one before incorporating anything. If your anxiety is severe enough, your mental health expert may recommend medication if they believe it will help you. Discuss your concerns with your physician. What is the point at which my anxiety becomes a problem? It's tough to figure out what kind of anxiety you have because your body reacts differently to different levels of perceived risk. People who use concern as a cover for anxiety are likely to identify with you. If anxiety is occasionally developed in preparation for a forthcoming event with a conditional nature, it is in anticipation of it. Danger is an unavoidable part of life. However, anxiety can grow from moderate levels to a full-fledged crisis that begins as an episode and becomes increasingly harder to bear over time, unlike a blue panic episode which only lasts a few minutes. How to get rid of anxiety quickly. Number 1. Double-check that you're in the correct time. An anxious mindset is one that is preoccupied with the future. Instead of obsessing about what will happen, focus on the present moment. Ask yourself what should be your concern right now. And is it good for me? If not, set an appointment with yourself later in the day to review your anxieties so that those far-fetched ideas don't hinder you from moving towards another goal. Number 2. Rename the situation. During a panic episode, you may feel as if you're dying or suffering a heart attack, but think the other way. You can say things like, "It's completely harmless. It'll pass in a few minutes." Also, keep in mind that it's the polar opposite of a death warning. The body is stimulating its fight or flight reflex, which is the mechanism that keeps you alive. Number 3. Check your assumptions again. According to professionals, those who suffer from anxiety are prone to focus on the worst case that can happen. To assist you overcome your concerns, consider how realistic they are. Let's pretend you're nervous about presenting a proposed project to your boss at work. You're thinking, "I'm nervous, however, I know I'm prepared." Instead, you can say, "I'm gonna nail this." Accept that some things will go according to plan, while in some instances it may not. Learning to accept possible outcomes and rethinking your anxieties will help your brain build a reasonable reaction to your anxious thoughts if you make it a habit. Number 4. Inhale deeply and exhale slowly. Deep breathing will assist you in unwinding. Even if you've learned about different breathing exercises, you don't need to focus on counting out a set number of breaths. Instead, focus on evenly inhaling and exhaling. Doing so will help you relax and refocus your thoughts. Number 5. Stick to a regular de-stressing routine. Look around you and make a list of 3 items you observe. After that, write down 2 of the noises you hear. Finally, change the orientation of your ankle, fingers, or arm in 3 distinct ways. If your mind is racing, this mental trick will help you calm yourself and bring you back to the present moment. Maintaining a healthy lifestyle could be a long-term coping method. Number 6. Getting started right away. Standing up, taking a walk, or moving around as much as you can will help you regain energy or keep the flow. It can be a daunting task to think about, but just take action and it will get easier to work on. Number 7. Sugar should be avoided. It's tempting to reach for something sweet when you're wary, but studies suggest that eating too much sugar can make you feel even more uneasy. Drinking a glass of water or eating protein instead of grabbing for the candy cup will provide a slow amount of energy that your body will use to repair. It is common for people to feel anxious in response to stressful events or situations, and there are many ways to deal with anxiety, but just remember that even during the hardest of times, there will always be a silver lining. Focus on the light at the end of the tunnel. If the suggestions don't work, you might wish to seek expert help. Even if you believe you have an anxiety disorder that is interfering with your everyday life and that you have seen or experienced physical manifestations, these issues can still arise. We'd like to hear your thoughts. What do you think of this video? Don't forget to subscribe to the channel if you want to see more of these, and make sure to check the description box below for our best recommendations to get you started. Also, check out our other videos as well. Thanks for watching. See you in the next video.